This medication, Zomacton Vial, is used to treat conditions such as growth failure, growth hormone deficiency, short bowel syndrome, HIV-related weight loss or wasting. It can also be used to increase height in children with certain disorders such as Noonan syndrome, Turner syndrome, and idiopathic short stature. The dosage and timing of Zomacton Vial should be determined by a healthcare professional based on individual needs and medical condition. Before starting to use Zomacton Vial, it's important to read the patient information leaflet that comes with the medication. If you have any questions, consult your doctor or pharmacist. The dosage of Zomacton Vial is based on your age, weight, medical condition, and response to treatment. It's important to use the medication exactly as prescribed by your doctor. Some brands of this medication are given by injection into a muscle or under the skin, while others may only be injected under the skin. The way you inject this medicine will depend on the brand that you are using. It's important to change the location of the injection site to avoid problem areas under the skin. If you are giving this medication to yourself at home, learn all preparation and usage instructions from your healthcare professional. Do not shake while mixing the solution, as shaking makes the medication not work properly. Before using, check the product visually for particles or discoloration. If either is present, do not use the liquid. Learn how to store and discard medical supplies safely. If you are using a pen device, do not share it with another person, even if the needle is changed. You may give other people a serious infection, or get a serious infection from them. Learn how to store and discard medical supplies safely. If this medicine is used for short bowel syndrome, consult your doctor if a special diet, high carbohydrate/low fat, or the use of nutritional supplements may be helpful. If this medicine is used for weight loss/muscle wasting, it may take up to 2 weeks to notice the effects of the drug. Do not use more of this medication than prescribed or use it more often since the risk of side effects will be increased. If you experience headache, nausea, vomiting, tiredness, muscle pain, or weakness, inform your doctor or pharmacist. This medication has been prescribed because your doctor has judged that the benefit to you is greater than the risk of side effects. Many people using this medication do not have serious side effects. Some serious side effects may include nausea/vomiting that doesn't stop, the development of a limp, unusual tiredness, unusual/unexplained weight gain, cold intolerance, fast/slow heartbeat, ear pain/itching, hearing problems, joint/hip/knee pain, numbness/tingling, unusual increase in thirst or urination, swelling hands/ankles/feet, change in the appearance or size of any mole, severe stomach/abdominal pain. Get medical help right away if you experience vision problems/changes, seizure, or severe headache. Rare, possibly fatal, lung/breathing problems may be caused by this medication in children with Prader-Willi syndrome. Somatropin may increase your risk of getting a tumor or cancer. A very serious allergic reaction to this drug is rare, but get medical help right away if you notice any symptoms of a serious allergic reaction. If you notice other effects not listed above, contact your doctor or pharmacist. This medication may contain inactive ingredients that can cause allergic reactions or other problems. Before using Zomacton Vial, tell your doctor or pharmacist about any allergies you have. Also, let them know about your medical history, especially if you have diabetes, kidney disease, cancer/tumor, thyroid problems, or if you are pregnant or breastfeeding. If you have diabetes, this drug may increase your blood sugar. Be sure to check your blood sugar regularly and share the results with your doctor. If you notice any symptoms of high blood sugar, such as increased thirst or urination, let your doctor know right away. When this medication is given to newborns, it should be mixed with sterile water for injection that does not contain a preservative. If the liquid used to mix this product contains a preservative, it can rarely cause serious problems, especially in lower birth weight infants. If you notice sudden gasping, low blood pressure, or a very slow heartbeat in your infant, contact your doctor immediately. Before having surgery, make sure to inform your doctor or dentist about all the products you use, including prescription drugs, non-prescription drugs, and herbal products. If you are an older adult, you may be more sensitive to the side effects of this drug, especially effects on blood sugar and swelling ankles/feet. During pregnancy, Zomacton Vial should only be used when clearly needed, and it is unknown if this drug passes into breast milk. Be sure to consult your doctor before breastfeeding. When taking Zomacton Vial, it's important to be aware of potential drug interactions. These interactions can affect how your medications work and may increase the risk of serious side effects. It's important to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share this list with your doctor and pharmacist. It's crucial not to start, stop, or change the dosage of any medicines without your doctor's approval. Additionally, it's essential to note that somatropin, the active ingredient in Zomacton Vial, is very similar to lonapexamitropin. Therefore, it's important not to use medications containing lonapexamitropin while using somatropin. This is to ensure the safe and effective use of Zomacton Vial for your specific needs. When considering the benefits of Zomacton Vial, it's important to follow the prescribed daily dosage and take the medication at the optimal timing recommended by your healthcare provider. This will help you to maximize the benefits of the medication and minimize potential risks. If someone has taken too much Zomacton Vial and is experiencing serious symptoms like passing out or trouble breathing, it's important to seek immediate medical attention. In the U.S., you can call your local poison control center at 1-800-222-1222. In Canada, residents can call a provincial poison control center. Symptoms of overdose may include severe headache, severe nausea/vomiting, signs of low blood sugar, such as sudden sweating, shaking, confusion, and ongoing swelling of the hands and feet. It's important to be aware of these symptoms and seek help if needed. It is important not to share Zomacton Vial with others. Your doctor may also conduct various medical tests while you are using this medication, such as eye exams, thyroid function tests, glucose level tests, and growth hormone antibody level tests. It is important to attend all your medical and lab appointments and consult your doctor for more details. Make sure to take each dose of Zomacton Vial as prescribed by your doctor. If you happen to miss a dose, be sure to consult your doctor or pharmacist for a new dosing schedule. Do not take a double dose to make up for the missed one. Be sure to follow the storage instructions provided in the product information and consult your pharmacist for any specific details. It's important to keep all medications out of reach of children and pets. When it comes to disposing of Zomacton Vial, do not flush it down the toilet or pour it into a drain unless specifically instructed to do so. Make sure to properly discard the product and it is expired or no longer needed. You can consult your pharmacist or local waste disposal company for guidance on how to do this properly. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.